To present the role of standards and interoperability in the Philippine digital health strategy, let us virtually welcome Dr. Alvin Marcelo.
Thank you, Gabby. This is a webinar that we're offering today, and there will be a series from here on to also engage the local community on the standards and interoperability efforts of the Department of Health, PhilHealth, and all the other public and private stakeholders in the country. So the Digital Health Summit was held last March 6 to 8 at Makati Diamond Residences with support from the Asia eHealth Information Network and the UNICEF. Of course, this is led by the Department of Health. And in the next few slides, I will present the proceedings that came out of the Philippine Digital Health Summit. So within the summit, the Philippine Digital Health Strategy was presented. The strategy starts with a situational analysis of our current challenges. And this was a slide coming from DOH to basically just set a baseline that these are not very good numbers and we need to start improving. And 59% of private primary care facilities do not have electronic medical records, and more than 2.3 million households still do not have access to stable electricity. Of course, we are all familiar with the Universal Healthcare Act. This is RA 11223. Health information systems will play a big role in making sure that the Filipinos have access to those types of quality information. Then Secretary Ted Herbosa released the 8-point action agenda. And if you drill down to number 3, he mentions the use of technology para sa mabilis na serbisyong pangkalusugan, basically giving a directive for all of us to use technology to improve the services that we're offering to our countrymen. He said, we have a lot of problems in the country, but let's choose the first 8 to focus on. There are 4 strategic interventions identified by DOH. Here is a very simple Venn diagram. Health domain on the right, and the technology domain on the left, and the intersection is called digital health. The key digital health interventions of the DOH right now is follows the GAPS process of AHID as well. Now here are the 8 Tier 1 projects. These are the most important projects in the next 5 years. The first is the DOH digitalization. I mentioned earlier that DOH has adopted the Open Health Information Exchange as an interim architecture. They went further, the Department of Health, and identified which of the specific agencies or existing applications map with the OpenHIE architecture. It might be difficult to remember everything. Just remember 888, the 8-point action agenda, the 8 priority outcomes: immunization, nutrition, maternal care, TB, HIV, hypertension, DM, road safety, cancer, WASH, and then the 8 Tier 1 projects, which we are showing here mapped over the OpenHIE architecture. If you can remember this 888 and find yourself, look for yourself inside that 888. That's what we need to do together in the next 5 years. So what's the role of standards interoperability? Because we think there's a need for all the stakeholders to come together, know each other, build trust, and know what is this interoperability all about. We formed the UPM SILab.
So we have with us here our lab manager, Sir Manu Gaspar, briefly introduce the community of practice of UPM SILab.
This community, or COP, is a dynamic, growing community of experts and practitioners dedicated to advancing standards and interoperability. In this community of practice, you can share insights, solve challenges, and collaborate on best practices to enhance your systems, processes, drive innovation across different healthcare solutions. So join us in shaping the future of seamless data exchange. Signify your interest to join